Hi, I'm Dr. Jeffrey Gleimer, orthopedic spine surgeon with Regional Orthopedic in Cherry Hill, New Jersey. When I finished my fellowship in spine surgery, the question was where to practice. And to me, it was no place like home. I grew up in Cherry Hill in southern New Jersey, and my father, who's also an orthopedic surgeon in the community, was the perfect choice. So I've worked with my father now for the last 7 years. I think when it comes to spine surgery, fear used to be justified. I think that fear existed because we all had a neighbor, a friend of grandma that had spine surgery and swore that they were never the same again. I think these fears need to be put to rest. With the Camber Spine Enza ALIF cage, we can really put a lot of these concerns to rest. Minimally invasive spine surgery is the future. People are able to have surgery and go home the same day. They're able to have surgery and go home the next day with fusions. Spine surgery used to require a foot-long incision in order to get into the body and fix the problem. These days, we have instruments and implants that allow us to fix and correct the problem in the spine, and the wound can be covered with a Band-Aid. So this ALIF cage truly allows for a one-step insertion, impaction, and then fixation of the cage itself. Less dissection, less exposure needed, smaller incisions, and you can truly place this device with ease. We can only live with pain for so long. It's one of the things that I tell my patients. I'll never have to convince you to have spine surgery. The fear of surgery, unfortunately, rules a lot of people's lives. But what I would try and relay to those people that have been living with pain for too long, and too long is variable. For some people that's a day, for others it's 10 years. But if it's too long, it's too long. And there's no reason to. When you have these options and the technology now that has truly changed the front of spine surgery, people really get better quicker. I think for every 10 horror stories that we might hear about someone that's had some level of surgery on their back, you don't hear about the good stories. That's why I offer a lot of them to speak to patients that have had the surgery. I think it's truly important for someone to have a relationship that they can trust with their surgeon.
I lifted 10 to 65 pound cases of soda, 12 hours a day, 6 days a week. And that is how I, originally got hurt. I lived with the pain for 2 years and it just kept getting worse and worse.
I know I was involved in a car accident approximately maybe 25, 30 years ago. The pain was getting worse, back was getting worse, losing my quality of life. I'm a very outgoing woman, so the fact that I couldn't do a lot of things was very frustrating.
I have my youngest is 3, soon to be 4. I have 2 6-year-olds and an 8-year-old. I was always telling them I can't do this, I can't do that. Now I don't have to tell them that.
My initial reaction was no. I didn't want to go through what everyone said that I was going to go through. But as he educated me, that's when I felt better.
Before the surgery, I had to have my wife feed me, help me to bathe and all those things I could do myself again. I mean, at 48 years old and having grandchildren live with me, having to ask your wife to do those things for you is very discouraging. I should be a role model for them, not saying, oh, Pop, he can't do anything. That's not showing them what it is to be good in life.
My kids are very active and they love to play. And it just means the world to me to have the ability to do that with them.
I am happy that I did make the decision to have the surgery.
Don't be afraid to live again, and that's what a lot of people do. It can always be worse, but it can also get better.
If you're thinking of getting the surgery done and you're not sure, you're afraid, the best thing I can tell you is if you have a doctor, honest to goodness, like Dr. Gleimer and his team, someone who's going to walk with you the whole way through, not just the surgery and then drop it. Always accessible whenever you needed him. He'd just call my office, I'll be there. If you have a team like that, then you won't be afraid.
Our new office in Cherry Hill gives us the opportunity to really redouble our efforts to provide a higher level of satisfaction for our patients. From the smiling faces at the front desk to the physician or the nurse waiting for them in the examination room, I think you'll come in here feeling that you got the time and the attention of that healthcare provider, whether it's one of our physician assistants, our nurse practitioner, or one of our 10 physicians in the practice that gives you the time to truly address the needs and concerns that you have. No one wants to be in pain. The first step is getting into that room with one of us, and then we start the process to get you better.